Hi, I'm Gerardo Cerboni. I'm going to be talking today to a soccer college team about ankle sprains. Good afternoon, guys. I'm Dr. Gerardo Cerboni, and I'm a chiropractor, and I'm here today to talk about ankle sprains because this injury is the most common in your sport, and it happens to be the most common reason why athletes visit the emergency room. So I thought it's going to be a good subject to connect with you guys. Also, I I used to play soccer too in a college level, and that was my main injury all the time. So I can relate with you guys. If how many of you guys have had an ankle injury? See, there's a lot of you guys, at least a little bit. So you guys know what I'm talking about. And I know how important it is to get back to the field real quick once the season is going. You have games weekly, more than one sometimes, and you don't want to miss it. We all want to play, right? And we tend to skip and don't do a good job in rehabilitating our injury, and that's why we just keep injuring ourselves the same way. In this case, twisting your ankle, that just stretches your ligaments, and once they're stretched, if you don't do anything to strengthen them back, you're just gonna have them very flexible and stretchy. And whenever you just step on something that is doesn't have a good how do you say level of your ankle's gonna go. So that's why you gotta do a lot of stuff to go back to your 100%. And yeah, and then it's gonna depend on what sprain you have. You could have three sprains, grade one, two, or three. Grade one is very mild. You just stretch your ligament. You probably can keep playing with that. You're just gonna be very sore at the end of the game. But grade two or three, um, those are grade two. You partially tear it, and grade three, you completely tear it. A lot of swelling, a lot of pain. Yeah. Grade one, 2 to 10 days recovery. Grade two, 10 to 30, and grade three, well, 30 to 90 days. That's a lot. How many of you guys really wait that long to go back play? Exactly. Nobody, and I include myself. I know. So it's very important, and you can twist it two ways, either outside or inside. This one is the more common. It happens in inversion of the foot and plantar flexion, a combination of both, um, and that injures the lateral aspect. That's why it's called like that. The lateral aspect of your ankle, right? So the main the principal protocol to rehab this, you got to do price protocol principle. It's composed of rest, ice, compress, and elevate. You're gonna be doing this for the duration of your recovery time, 20 minutes a day, maybe three times if you can. You gotta be consistent. You gotta be patient. um, if you're injured, you're injured. You can't play, and you gotta also let your coach know, because sometimes they are the ones that are pressuring you to go back to the field, and you gotta know your value as an athlete, and value your body because it's telling you um, to stop. So yeah, another thing that you should do, and this is gonna depend on how much the pain is going on, is to weight bear, to stand on literally in your foot. If it's too painful, don't do it, right? But as long as the pain gets a little bit more bearable, you gotta weight bear. You gotta let your brain know that your ankle needs attention. Okay, so yeah, and the other thing you can do is in this case, talking about the plantar flexion and inversion injury. So you gotta have to strengthen your dorsiflexors and your everters. So the opposite muscles, uh, the muscles that do the opposite movement of your injury, right? The way you can strengthen those are with elastic bands. To strengthen your dorsiflexors, you wrap around your opposite foot, and then you grasp it around the foot you want to strengthen, and just point your toes up. 15, 20 repetitions. Try to do it more than twice a day. Be consistent again. Same thing with eversion. Put your band in the opposite around the opposite foot. Grasp it around the foot you wanna strengthen, and instead of pointing up your toes, point your toes out against the resistance of the band, and that's gonna help you guys strengthen and do a proper rehabilitation. Right? There's a lot of other sort of stuff. You got laser, you got ultrasound, a lot of modalities that you probably can use. You can tape it too, and when you tape it with kinetic tape, for example, you're just gonna increase your proprioception, so it's gonna let your brain know, hey, my ankle needs attention, you know, so some sort of stuff like that. But also, there's something else. Have you guys heard about chiropractic? I see three hands. So, real quick, chiropractic is it focuses in the nervous system. Why the nervous system? You guys know why? Nervous system is very important. Very important because this is the system that deals with everything in your body, controls everything, your function, your organs, everything you can possibly think of, and it's composed of your brain and your spinal cord. Those are the main sources, and then there are little nerves that come out of your spinal cord. This spinal cord is gonna be inside your spinal column, and so your brain communicates with the rest of your body down through the spinal cord, and your spinal cord with the brain, and everything is inside the spinal column. So would it make sense to you guys that if you have a misalignment for whatever reason in any of your vertebrae in your spine, the communication is going to be, it's not going to be optimal, right? It makes sense. It makes sense. So that's where we as chiropractors come in, to make sure you're always aligned, and the main objective is, well, not to be aligned, but the real objective is to uh, uh, don't have any interference in the communication of that nervous system, and every aspect of your health is going to be significantly improved, and at 100% if your nervous system is working at its best. In your case, your ankle, you're gonna have to have a good low back alignment for that nerve supply to go down there. That's where the nerve supply comes from your low back. But we don't only adjust your spine. We can also adjust joints like your ankle, your knee, your wrist, your shoulder, everything. In this case, talking about ankle sprains, so once you sprain your ankle, you're probably going to be using extra hard your knees and hip, so we can check those, and once the pain is bearable enough, we can also adjust the ankle. So there's a lot of things we can do, and this is just a little bit of what chiropractic can help you guys to perform better. So if your communication is interference free for your nervous system, you're just gonna function better, feel better, live better, in your guys' case, perform better. So, what do you guys think? Do you want to get adjusted? Yeah? Come on.